Hello, and thanks for watching. My name is Josh Hogan. I'm one of the administrators of the Reopen Bucks group. Today is October 20th, 2021, and I'm going to be talking about the impact of school policies on COVID-19 community prevalence. This is a case study on Bucks County, Pennsylvania. The goal of this presentation is to observe the effect that school district COVID mitigation policies have on community prevalence within Bucks County School District boundaries. Before I get into that, let me answer a basic question. Why use community prevalence? First of all, the argument for doing COVID mitigation in the schools was always that children might spread COVID to adults at home. I think it's fair to say that most people have agreed since early on in the pandemic that children are at very low risk from COVID, but we didn't want them to bring it home and spread it within their households and communities. This was very succinctly captured by Dr. Scott Levy, Chief Medical Officer of Doylestown Health, who said in an August email to Dr. David Damsker, quote, "My greatest fear is not an 8-year-old developing COVID, likely mild. It is that child as a vector bringing the disease to unvaccinated parents and or vaccinated immunocompromised adults susceptible to serious disease," end quote. Another reason to use community prevalence is that the data from school district dashboards is riddled with problems. Here in Bucks County, less than half of our school districts even have a COVID dashboard. The ones that do all have different criteria for what they consider to be a case, and they all structure the data in slightly different ways. It's bad data to work with. In comparison, community prevalence uses big numbers. Bucks County as a whole is 630,000 people, so it's a big data set. Big data is a good thing. Lastly, focusing on in-school COVID numbers somewhat misses the big picture if it's not compared against community prevalence. Consider a community that has 50 cases, and 40 of those cases are within the school population. That community is doing pretty well because 40 of its cases can reasonably be expected to be mild, leaving only 10 cases among adults. There's likely only 2 or 3 cases among truly vulnerable people. Contrast that with a situation where the same community has 50 cases, but this time only 20 of them are in the school. Now, 30 of that community's cases are amongst adults, so there will be more cases among vulnerable people. So while in-school data is good to have, it needs to be combined with community prevalence to really get the full epidemiological picture. So, do differences in school district COVID mitigation affect community prevalence within school district boundaries? Let's start by getting some data. Here in Bucks County, we're going to get our data from the Bucks County COVID map, which you can find on the Bucks County Health Department's website. This map has been maintained by the health department since the early days of the pandemic, and what makes it special is that it organizes all cases by municipality, which is critical for us to make school district comparisons. The CDC data sets organize cases by zip code, which is a problem because there are many zip codes in Bucks County that are a part of 2 or 3 or more school districts. So by having this Bucks County COVID map, we have access to a municipality breakdown of the cases. That's going to allow us to make a perfect comparison of school districts, since each school district's boundaries are defined by the boundaries of its component municipalities. On the right side, you see the 54 Bucks County municipalities. What we're going to do is take those 54 municipalities and map them to the 13 Bucks County school districts. Note that there is one municipality, Telford Borough, which belongs to the Souderton Area School District over in Montgomery County, but the other 53 municipalities in Bucks County all exist within one and only one Bucks County school district. Now, hang with me here because this is the very hardest part. We simply have to define what community prevalence means, and then we can get into the good stuff. A school district's community prevalence is calculated using 3 simple steps. First, add up all of the case counts from the Bucks County COVID map for all municipalities within a district. Then, add up the population for all municipalities within that district. Then you divide the case count total by the population total and multiply the result by 100,000. As an example, consider a school district in which the municipalities had a combined 100 cases on a given day. The population of those municipalities is 80,000. Dividing 100 by 80,000 and then multiplying the result by 100,000 gives you a community prevalence of 125 cases per 100,000 people. It's a simple calculation, right? Well, what we've done is run this calculation for every school district every day since August 30th. And here are the results. It's kind of a rat's nest. It definitely is a bit noisy and hard to make any solid inferences, but there it is. All 13 Bucks County school districts charted by community prevalence since August 30th. Now we're clearly not going to be able to do much with this since it's so noisy, so let's look at slicing and dicing this data. We're going to start by breaking up the data geographically. In the 6 weeks that I've been monitoring this data, there really has only been one observation that I feel has been truly consistent, and that is that the Upper Bucks school districts have run hotter than both Middle and Lower Bucks, which have been roughly similar to one another. So Upper Bucks is represented by the yellow line, and you can see that it's consistently higher in community prevalence than the other two. Now the upper, middle, lower designation comes from which technical school each school district reports to. So Upper Bucks Tech receives students from Penridge, Palisades, and Quakertown. Middle Bucks Institute of Technology takes students from Centennial, Central Bucks, Council Rock, and New Hope, etc. If we look into each geographical grouping, we'll start here with Upper Bucks. In a few slides, I'm going to show you that Penridge is far and away the most normal school district out of these three. Quakertown is probably the second most normal, and then Palisades is pretty highly COVID mitigated. Now, with exception of a slightly anomalous surge in Quakertown during early September, these three districts seem to track relatively tightly, certainly all throughout October, despite having very different COVID mitigation going on. If we look at Middle Bucks, you'll see that the grouping effect is even stronger. In this case, Council Rock is the most normal school district, closely followed by Central Bucks, and both Centennial and New Hope are very into their COVID mitigation efforts. Despite those differences, though, you can see that they basically just clump together. One thing to note is that the New Hope line looks a little bit more erratic. That's actually just a flaw in the data reporting. Because New Hope is such a small school district, similar to, say, Bristol Borough or Morrisville, it's susceptible to these erratic swings because, a handful of cases makes a much bigger difference in a small population than it does in a much larger population like Central Bucks. Since we're talking about prevalence rates, that difference in size causes the smaller school districts to just seem more erratic. Lastly, in Lower Bucks, we see that it's a little bit noisy because we are talking about 7 districts, but by and large, they all follow the same trends with only a couple exceptions that seem to correct themselves pretty quickly. Now let's compare community prevalence based on school districts' COVID policies. What you see here is all 13 Bucks County school districts, along with their mask and quarantine policy. You'll notice that most Bucks County districts are strictly enforcing the current statewide mask order in schools, meaning that they require a documented 504 or IEP in order for a student to go mask-free. Also, most Bucks County districts are strictly enforcing quarantine, which means that a close contact of a COVID-positive student is sent home. On the mask policy, we do have a few districts that are allowing mask exceptions with only a parent signature. These are Central Bucks, Council Rock, and Penridge. Quakertown also has the same policy as voted on by the school board. However, that policy has been basically thwarted by the school administration, which has been working to minimize mask exceptions. You can hear all about that if you watch the latest Quakertown school board meeting at the YouTube link on the bottom. We also have Neshaminy, which is requiring a note from a medical professional in lieu of a documented 504, so they do have a slightly less stringent policy on that front. As for quarantine, we have 5 districts which are essentially not quarantining close contacts. This means that in these districts, if a student sits next to someone who winds up testing positive, that student continues to go to school as long as they are healthy. They do not quarantine, they do not miss school. Quakertown doesn't quite go that far, but they do offer modified quarantine to close contacts instead of at-home quarantine. So what we're going to do is take the 3 school districts who have simple parent-signed mask exception forms and also do not quarantine close contacts, and we're going to put them in their own bucket. Now, 2 of these, Council Rock and Penridge, have DADT right there in the mask policy. That stands for Don't Ask, Don't Tell. That means that those 2 school districts do not have teachers spending time investigating which students have mask exceptions and which students don't. So you wind up having a very large number of students not wearing masks. In both Council Rock and Penridge, a majority of students do not wear masks at all grade levels, and particularly at the high school level, a very strong majority of students are mask-free. So here's what our comparison looks like. We have Pennridge, Council Rock, and Central Bucks, which have met our criteria, and they're shown here in bright green. The other 10 districts, which don't meet our criteria, are marked in red. What we're going to do is pit their municipalities against one another to see how their community prevalence compares. Now, before we look at the chart, I want to be clear on the size and scope of the data you're about to look at. Pennridge, Council Rock, and Central Bucks collectively have 242,000 Bucks Countyans living within their borders, and the other 10 school districts have 386,000 Bucks Countyans in theirs. So these are very big data sets, and the duration of observation has been a little over 6 weeks, from August 30th to today. This chart is what you might call a mic drop. As you can see, from when school started on August 30th to today, there's been essentially no discernible difference in community prevalence between the group of districts that are more normal and the ones that are much more COVID mitigated. In fact, the green line representing Pennridge, Council Rock, and Central Bucks has actually had less total area under the curve, meaning less total cases per population. Today, as of this moment right now, Pennridge, Council Rock, and Central Bucks actually have a little bit less. So this begs the question, these 10 districts are either quarantining healthy kids or forcing them to wear masks. Are they actually achieving anything with those policies? It appears not. To drive the point home a little bit further, here is the 3 more normal school districts compared against the countywide average. You can see that Pennridge, being a part of Upper Bucks, which has run higher the whole time, is indeed above the average, but Council Rock, which has a solid majority of students not wearing masks and does not send close contacts home to quarantine, Council Rock has actually been below the county average every single day of the school year so far. One last point to make is to compare the effect that school opening has had on community prevalence this year versus last year. Last year, the vast majority of Bucks County schools did not open in August or September. They were completely closed and the students were at home. Yet between August 30th and October 19th of 2020, the Bucks County 7-day average increased by over 50%. This year, with all schools wide open and many of them, almost the majority of them, normal, the 7-day average has decreased by 12% over the same time period. This year definitely has much bigger numbers, which is an issue for another TED Talk, but what's important to note is that the overall reproductive rate last year was much higher with schools mostly closed, and it's lower this year with them wide open. So, final verdict, school district COVID mitigation policies do not correlate with difference in their community prevalence. By comparing to last year, we might say that this even applies to whether or not schools are open at all. Before I wrap up, I'd like to give a big and heartfelt thank you to the school board directors in these 3 school districts. These names are the board directors who voted affirmatively for the most recent health and safety plans, which not only allowed their students to have access to a relatively normal education, but have also provided us with somewhat of a control group to be able to make the comparisons that we have in this presentation. I'd also like to thank the school administrators, teachers, and staff in all Bucks County school districts. Obviously, there are administrators, teachers, and staff in every school district who want more COVID mitigation, and there are those who want less COVID mitigation. But collectively, they've done their jobs and implemented their health and safety plans diligently. And lastly, I'd like to thank Dr. David Damsker, who somehow miraculously threaded the needle by providing these board directors with the tools they'd need to weather the storm without him. Here are a few simple questions for everyone else who's involved in making school-related decisions, including current board directors and election candidates. How long will you cling to mitigation practices that clearly do not have discernible benefit? What clinical outcomes do you believe your mitigation practices have achieved? What clinical outcomes do you hope to achieve moving forward? How long will you watch Pennridge, Council Rock, and Central Bucks successfully offer a normal school environment before you decide to do the same? If you have any questions, comments, or concerns, or if you'd like access to the complete 6-week data set that I've captured from the Bucks County COVID map, please shoot me an email at info@reopenbucks.com. I hope this has been useful and informative to you, and thanks for watching.